time for tonight's Sterling Health feature with Travis Sterling of Sterling Physical Therapy, who's contracted with Pella High School for on-site injury evaluations. Tonight's topic is ACL injuries. Travis, what is the ACL and what does it do?
Yeah, the ACL is really the workhorse ligament of the knee. It provides stability in multiple directions and really gives an athlete the ability to cut, jump, land, do all the things they need to do to be successful in sports.
You hear a lot about the ACL injury, especially at the national, football league level, the college level, and even, unfortunately, at the high school level. What are some things that you do if an ACL injury does occur here on the football field?
Obviously, we evaluate it right at the point of injury, and before spasming sets in, we can really get a good examination on the field or sideline for identifying what it is. If it is truly an ACL or the ACL is involved, then we will refer them to an orthopedic surgeon. They'll typically do x-rays and MRI, and then if it is totally torn, they'll have to do a reconstruction.
What about preventative for ACLs? I've heard about knee bracing and things like that. What's your take on that?
Yeah, knee bracing, it's probably split 50-50 across the nation on whether to use one or not use one. A lot of times with linemen, it's important to try to use an ACL brace, functional brace we'll call it, to limit their exposure to ACL injuries or positions that could cause an injury.
But for other positions other than linemen, maybe not?
Yeah, a lot of times, other positions don't like to be, basically weighted down with the brace, feel like that it might slow them down a little bit. So, yeah, a lot of other positions don't use that.
If an athlete does suffer an ACL injury, what can Sterling Physical Therapy do to help those athletes in their recovery?
Yeah, there's usually two things. If it's just a sprain or a sprain meaning some looseness of the ACL, we can do an ACL deficient program, meaning that we'll try to strengthen the muscles around the knee to take the pressure off the ACL and allow the athlete to get back to sports. Second and more drawn-out issue is if they do have an ACL surgery by an orthopedic surgeon, then we take them through all the phases of ACL physical therapy and then get them back to sports with an ACL management program.
All right. Our thanks to tonight's guest on our Sterling Health feature, Travis Sterling of Sterling Physical Therapy, where they provide you with the Sterling standard of care.